Hi folks, this is Dr. Burke Mays with Pathways Integrative Health. We are on step 3 of our 22-part journey looking at some of the background causes of why a person has poor thyroid function. So we're going to assume you watched some other videos where we talk about brain function and how a neurological based chiropractic approach can help brain function. Today we're just going to focus on one segment of it, which is step 3, which is poor hypothalamus function due to systemic inflammation. You know, inflammation is endemic in our society. We have lots of different causes to it. When our body is inflamed, when I say inflamed, imagine like if you hit your thumb with a hammer. Your thumb gets all red and swollen and what we call inflamed. And that's an appropriate response. We're talking about meta-inflammation, where your whole metabolism is oriented towards being inflamed like your injured thumb. It's kind of oversimplified. That's kind of the basics to it. But we have systemic inflammation. We'll talk about some causes about that in a minute. You release a lot of chemicals called cytokines. Cytokines are just immune and inflammatory chemicals in your body that then decrease the function of your hypothalamus, and the hypothalamus then tells the pituitary to make your TSH. So if your hypothalamus isn't working at high enough level, you get decreased stimulation of the pituitary, less TSH, and then you get poor thyroid wellness. So causes of systemic inflammation: gut infections. That can be parasites. That can be imbalances of good bacteria in your gut. That can be lots of different things. It can be chronic viruses. That can be cytomegalovirus, Epstein-Barr virus. You name the viral infection, it can be a cause to it. Lyme disease, or more accurately called now tick-borne diseases. I mean, it used to be just Lyme's, but now we have so many other bacteria spread by tick bites: Borrelia, Bartonella, Ehrlichia. And if you look on the map in this part of the country, this is like here in Wisconsin, like the hotbed of tick-borne disease infections in the country. Food sensitivities. The foods that we eat are new. So many of them have been genetically modified. They've been highly processed. They are foreign proteins to our body, and our body reacts to them inappropriately. It creates immune response and it creates inflammation. A leaky gut. When the junctions between the cells in your gut start to break down, it's kind of like imagining that you have holes in your screen door. Bad things get into your house. Well, in this case here, bad molecules get into your bloodstream. Your immune system starts to react to them, creates an inflammatory response, and you have systemic inflammation. And keep in mind too, when that gut barrier breaks down, like the screen door, that also is the same thing as your blood-brain barrier. So now your brain's getting exposed to different things, and that's the brain fog and the immune response in the brain. An inflammatory diet. The American diet, ironically abbreviated SAD, Standard American Diet, is highly inflammatory with bad quality fats, highly processed foods, all things that promote inflammation. And then there's molds and pollution, things in our environment, things that create immune response or inflammatory to our body. When you walk outside, we take a deep breath, we take in more chemicals in that breath than our great-grandparents did in almost their entire lifetime. So symptoms of chronic inflammation. We're starting to discover that inflammation is a key underlying part to almost every health condition. It can be part of chronic joint and muscle pain, brain fog, arthritis, fatigue, swelling of feet and hands, high blood pressure, neurological changes. Inflammation is a background component to cardiovascular disease and cancers and allergies, and you name the symptom that people are experiencing, inflammation is part of it. That's why it says ... Just keep on going. So that's another part of our 22-part journey. Thank you for watching. Look forward to seeing you in the next video. I'm Dr. Burke Mays. We'll talk to you soon. Thanks for watching.